Hello, everybody. Good afternoon. And today we're going to be talking about endometriosis. Today's our Endometriosis Awareness Month special. And we have a very, very special guest joining us. And until she does, I am just going to be talking a little bit about endometriosis and what it is. Endometriosis is a reproductive disease. It affects up to 10% of reproductive age women, and it is essentially when the endometrium, or when the inner lining of the uterus, grows outside the uterus. And it can grow anywhere on the inner lining of the abdomen or other pelvic organs. Usually it affects the peritoneum, that's the inner lining. It can grow on top of the bladder, bowel, fallopian tubes, or within the ovaries as a cyst. It does not affect everybody the same way. Some people have pain that is excruciating, even with perhaps a few endometriosis lesions. Some people have endometriosis everywhere with their organs glued together, but may not feel it at all. So the pain cannot be staged, but endometriosis can be staged, and the classical staging is stage 1 to 4. So it can certainly impact women's health, and the most common symptom that it causes is excruciating periods. And it can also come hand in hand with really painful cramps, heavy bleeding, and nausea, gastrointestinal pain, GI discomfort during the time of the period. It may also cause pain during intercourse or intimacy, and may also be associated with infertility. Many patients with endometriosis may also have struggles with fertility. And conversely, in our fertility worlds, a large percentage of patients that we treat have endometriosis, and many of those with unexplained infertility, meaning nothing could be found on any sort of diagnostic workup, are found to later on have endometriosis. So it is certainly something that impacts everybody's daily lives. And I'm sure everybody joining us today knows somebody, whether it's themselves, somebody close to them, their family or friend, or perhaps a coworker that might be affected by this. So that's why we have Endometriosis Awareness Month, because every person that knows a little bit more about endometriosis may be able to identify it in someone else, and we all deserve to give each other grace for the tough things that we go through in our lives. And spreading that awareness if that makes one less person think that they don't have symptoms that they're making up in their head, then that'll make the world a better place. That's where we're starting. So if there are any questions from the group, I'm happy to answer those. Otherwise, I will just keep talking. We can briefly talk about how endometriosis might affect fertility. So endometriosis may cause scarring and inflammation within the pelvis, and that general heightened state of inflammation may affect the way the fallopian tubes function, and may affect the way the egg, which is ovulated into the abdomen, is picked up by the fallopian tubes. It may also just impact the pelvic anatomy. So if the fallopian tube is affected in any way and is far away from where the egg is ovulated, then it may not be able to pick it up. So a distortion in pelvic anatomy might play into that, in addition to the inflammation. Tubes may be blocked as well for any reason that is associated with endometriosis. If there are endometriosis-associated cysts, so an endometriosis cyst of the ovary is called a endometrioma, also known as a chocolate cyst, and those are filled with old blood, inflammatory tissue, and in general may also affect the egg quality and quantity if somebody's doing something like egg freezing or IVF. And this may impact spontaneous conception rates as well. Not in everybody, but this is just in some cases. When an embryo is making it all the way into the uterus, and implantation and that environment of the endometrium is very, very important. It's thought that perhaps in patients with endometriosis, that implantation potential may be affected as well. Not in all cases, but some studies suggest that there are perhaps some different proteins expressed. So I think that a lot of the cases that we see where we may hear that endometriosis impacts implantation is actually when endometriosis is associated with adenomyosis. Adenomyosis is when those glands that are in the endometrium grow into the uterine muscle. The uterus is a big, thick muscle, and when these blood vessels, glands grow in a little bit, it makes periods much heavier, much more painful. Adenomyosis is not mutually exclusive of endometriosis. They are often associated, but they can be separate conditions as well. And that can definitely affect implantation and miscarriage and live birth rates. So now let's talk about diagnosis. And I may be repeating all of these things in a little bit, but that's okay. When we talk about diagnosis, the gold standard for endometriosis diagnosis is with laparoscopic surgery. Laparoscopic surgery means a minimally invasive surgery where you have a hole in your belly button, perhaps 2 or 3 other small holes in the abdomen, and when the surgery occurs, endometriosis has to be identified and then excised. Later on, it's looked at under the microscope, and a pathologist then says this is endometriosis. So that's the gold standard diagnosis of endometriosis. It's also the treatment. If every lesion that's seen is excised, then that can essentially treat it, but it doesn't mean it won't recur. The most commonly accepted theory as to why endometriosis occurs is called the retrograde menstruation theory, or Sampson's theory. That is the theory where it's formed by blood that flows backwards from the fallopian tubes. So in almost everybody, there may be some degree of retrograde menstruation. That is when blood flows. Most blood goes out through the vagina, but some flows backwards through the tubes. The fallopian tubes have to be open for conception, so a little bit blood can spill out that way too. And everybody's body reacts differently to that blood spilling out. In some, it's reabsorbed and it's not a problem. But in some, and of course, that blood may also contain bits of endometrium that was shed, because every month we grow the lining and then shed it. So those little bits of endometrium may have a lot of regenerative stem cell properties, and if they implant somewhere, they may form a life of their own, forming a network with blood vessels and nerve tissue and nerves. And every time there's a period inside the uterus where it bleeds out, it can bleed in those lesions outside the uterus too. And that blood has nowhere to go. So it can then cause scarring, fibrosis. Eventually it might be cleared, but that scarring and fibrosis is still there. And that's what's so hard to identify when people do surgery and say, oh, there was nothing there, but there really is still scarring and fibrosis. There's a question from the group. Let me read this out loud. My sister has had period pain for years, but it's to the point where she goes to the hospital, but her results always come back as normal. At what point is it period pain normal or endometriosis? That's a really good question. Really, really good question. If period pain, as we all probably have heard a million times, is normal. But at what level is it not normal anymore? If you are going to the hospital with that level of pain, it's not normal. And if it's not improved, not gone completely with ibuprofen, it's not really normal. If you go to the hospital and they do ultrasounds and they don't see anything, your blood looks normal, well, that's what we would expect to see with endometriosis. It can't really, unless it's a very, very advanced stage, you can't really identify it on imaging. So that is something that warrants a conversation with somebody's OBGYN to see whether your sister has endometriosis or not, because we can still have a very high suspicion based on somebody's symptoms. If a doctor that somebody goes to does not listen or says, I don't think she has this, and you really think that she does, get a second opinion. That takes a lot of patience and a lot of time and effort, but it may be worth it to help explain symptoms and to help with management and moving on in terms of a plan, a treatment plan. So we talked about Sampson's theory. We talked about diagnosis. So other methods of diagnosis, they're like I mentioned, in more advanced stages of endometriosis, you may be able to diagnose it, again, not 100%, but have a very, very high suspicion from imaging. Those imaging modalities are ultrasound and MRI. With MRI and ultrasound, we can see things called endometrioma. So those are the chocolate cysts of the ovary. If we see that, then it likely means somebody has endometriosis and that it's already a stage 3 endometriosis, which is what an endometrioma qualifies as. If we see thickening of certain ligaments around the uterus or a big like nodules, that can be seen on ultrasound and MRI as well. And that would lead us to, again, having that very strong clinical suspicion. If it's stage 1 or 2, then we have less of a suspicion. Hello, hi, our special guest has joined us. Hello. Invite now. I'm so sorry for the delay there.
Hello.
Hi, Saraya.
Is it working? Okay.
Yes, thank you so much for joining us.
Hi. Sorry. So I was stuck in traffic, and then I finally got home, and I was like, oh my gosh, 10 minutes down. But yeah, I'm here. I'm ready to go. Hello, everybody. I got my dogs with me, ready to get started.
Thank you so much for joining us.
Yeah.
And I'm Seckin. I'm a fertility specialist here at Generation Next Fertility.
Yeah.
Bringing in from New York. And we were just talking a little bit about endometriosis and Endometriosis Awareness Month.
Yeah.
So I just wanted to know, what is your experience and journey with endometriosis?
Oh my gosh. I feel like nowadays it's really hard for women to get the treatment that they need for endometriosis, and it really, really sucks because I spent years and years, having this condition, and a lot of people don't understand what it is too. So I remember when I first came out and said, yeah, I have endometriosis, some people thought it was like a sexually transmitted disease.
Oh my.
And I was like, oh no, that's not what it is. It's something that, women struggle with, even the weeks that they're not on, it's their time of the month. It can affect your everyday life. And unfortunately, it happened with my mom, and she had to have a whole, womb removed with it, and I developed a lot of cysts, and I've had issues with like ectopic pregnancy before, and it's just very, very painful, and it can be very painful. And there's like different levels that you can have. Unfortunately, mine's really painful too. And I try to do different remedies because, I try not to do like pharmaceuticals. I try to do like natural stuff too to try and get me through it. And you know what? A bath really, really helps for a couple of hours, but yeah, it's rough. And I feel like it's just not a well-known thing, and it's such a shame because it affects so many women, like so many, like more than people realize. And when I spoke out about it again, I had men and women contacting me. Like the men were just like, oh my gosh, my girlfriend, wife, partner is affected by that too. Do you know any way that we, like, I could help her out, So yeah, it's just it's a hell of a disease to have. I will say that. And it's not fun to have, but it can be manageable. But I just wish that more people knew about it, honestly.
That's why we're doing this. So
Yeah.
I think that every single person that knows more about it and knows what it is
Yeah.
missed
Yeah.
by their doctor, even by their family members, by friends, coworkers.
Yeah.
And it's one less person that thinks they're crazy because they're not.
Yeah. No, and that's the point, is that everyone thinks you're crazy. Like, and it takes a while for people to really understand. Like my boyfriend now is very awesome with it. Like, I've been with him for 5.5 years, and he's always trying to find different things that can help me, on the days that I'm feeling like, even just because it can affect you mentally too. It's not just a physical thing. And so I'll have days where I'm just mentally like having a really rough day, and he goes above and beyond to try and help me, you know. But it's just crazy that, you know, people that are not aware of it, they just think like some doctors, not like yourself, because you're, you know, you know about endometriosis, but there are doctors that aren't familiar with that. And some of these doctors are just like, oh, you'll be fine, like it's just a period kind of thing. And you're like, no, it's more than that. I'm telling you, I know my body, like it hurts, you know. It's like, it's not fun.
How many doctors did you have to go to before someone pointed you the right
Oh my,
direction?
my gosh, so many. I like people don't realize at all. And even now I'm so lucky that, you know, my team found you, because you're amazing. And you know, we're going to be hopefully doing the egg freezing and stuff like that, because that can help out long term for people with endometriosis too, because it can affect fertility, you know, depending. And so I'm really excited about that though, because it gives you like a chance to still be, you know, a parent and stuff. But yeah, it took a long time. It takes a long time. And like, you know, and there's not as many endo doctors as people think too, you know. So it's difficult. You kind of go through the weeds, and then you find someone like yourself who is just so amazing, you know. And I love what you do for people. Seriously, it's just again, unless you have endo, you don't understand how difficult it is. So I'm just really appreciative for doctors like yourself that help so many people.
Thank you. That's so kind. It's a struggle for doctors that are fighting for patients to get better care too, because like you said, there aren't enough doctors that take it seriously and commit their lives to it.
Yeah.
In the US, it's a big problem because of course, Americans have their crazy insurance, and
Yes.
the doctors that that are very, very good at it sometimes don't want to do it because for insurance coverage, because it only covers for a 1 hour surgery, but it's so much more than that. It can
Yeah.
be as complex as a cancer
Yeah.
surgery in terms of the time and the skill that somebody needs to do it.
Yeah.
And I'm sure it's tough in the UK too. I know that it has its own healthcare issues, but
Yeah.
at least starting from a place of diagnosis, well, being aware and then having a suspicion for it and treating it the right way and referring to the right people is it's that's a start.
Yeah. And I thought I was because I only found out I had endometriosis about 4 years ago, 4.5 years ago, and I went through an ectopic pregnancy.
Oh,
And they got that, you know, the doctor, she was really great, and she was the one who was just like, oh, you have endometriosis, because obviously going in there and like cleaning everything up, and you know, she was just like, yeah, that's what you have. But she was like, you know, she kind of pointed me in some directions for it, but like it just didn't work out. But it just made sense to me, because I always thought I was crazy because I didn't know what it was, or I wasn't familiar with it. And I just thought like all periods felt like that. And it's not supposed to be that painful. It's not. Like my whole legs were aching, like my knees would be aching, and my back, and I'd have sharp pain. Sometimes I get it in my chest too. It's just like, it's rough. And it made me feel like, okay, I'm not crazy. Like I actually have something that not necessarily wrong with me, but like something that, you know, I knew there was something going on in there,
yeah.
you know,
Of course,
be validated.
surgery is not zero risk, and there's a reason you had your surgery. But when it is diagnosed, it can be incredibly validating. I mean, and
Oh,
get your surgery done, then you can feel a lot better after than that too. I mean,
mhm.
uh, it's not something that's 100% curable. It may recur because the theory is that the blood that normally goes out through the vagina, some of it plus the endometrium tissue that's shedding every month, goes back out towards the tube, like through the tubes, and it can implant inside the pelvis. And not in everybody, but in some, that those implantations stay, and every
Yeah,
time you have a period inside your uterus, that area bleeds too,
yeah,
and it can cause that blood has nowhere to go, so
yeah,
it forms fibrosis, scar tissue, and pain, and obviously that's where it all starts.
yeah. And oh, sorry, my phone is of course blowing up right now. I'm like, stop texting me. um, but yeah, like I would suffer a lot from cysts too. Like a cyst was always like Gosh, and it was always on my right side. It's like just one side of my body too, and they would get really big and really painful. And people don't realize how dangerous having a cyst on your ovary can be too, especially when it bursts. And I've had that happen to me before. Again, before I knew about.
That's hospital level pain when it's this
Yes.
burst.
Oh my gosh, it's awful. And then your stomach kind of blows up like you're pregnant. Like it can get really, really bad. But I had it before, and I was actually, it was a long time ago, but I was actually wrestling. And before I even knew, again, what endo was, and like I was familiar with cysts, I was always prone to having cysts, but I had one that popped while I was wrestling. And then I was fine after that. Like for some reason, I didn't go to the doctor, I didn't do anything because I was kind of like, I was too paranoid about like my health. I didn't want anyone to know like something like painful just happened to me. So I kind of just like let it go. And I got quite lucky with it because it could be very dangerous. But now I know what the symptoms and the pain is. Anytime I feel that in any way, I'll just go to a doctor and they'll figure it out for me, you know, and they'll help me. But yeah, again, it takes like a few uh, gynecologists before they do help you though, because I have to be like, please, can I please get an MRI? Can I please get, you know, this, that, and the other? I know I have a cyst. I know I have something going on down there, you know. So it takes a few, but then eventually you get it done. But I wish it didn't have to be that difficult. It's so frustrating. You're like, I know, like, you know, I know my body. I know there's something going on. Like, just trust me on this. Like, I don't want any medications because I feel like sometimes people just think you want medication. I'm like, I don't want medication. I don't want any of that. I just want to feel okay again, you know. And anything you can do to help me would be a bonus. You know, I just want to feel normal.
Right. And I just wanted to briefly, for those who are listening, just talk about what endometriosis is and
Yes.
in a feel. So, endometriosis is when the inner lining of the uterus, called the endometrium, that's where the whole point of it is to have a nice bed for an embryo to implant on. Otherwise, it's useless to us all.
Yeah.
But that's when that inner lining starts growing outside of the uterus, and it can cause very, very painful implantations and very painful periods, very heavy periods, and periods with cramping, and it can cause pain outside of the period too. Mm-hmm. It can be associated with gastrointestinal cramping, bloating, nausea, sciatica. Sometimes it can grow all the way up into someone's diaphragm, cause pain. That's much more rare, but just to know the impact that it can have on some people's lives is very important.
I call it the endo belly because I'll have days when my stomach looks really big, and my boyfriend knows it now. He's just like, oh, I just know you're in pain, you know, when he gets me like a little hot water ball or something warm to like put on it because it really does help putting something warm on there. But yeah, like, and when I have to wrestle, I started wearing like, you know, I mean, when I was younger, like I would wear a little bit more low shorts, you know, but now like as I get older, I feel like it's not getting any better. I feel like it actually, the symptoms kind of get worse for me personally. And so like I get a lot more endo belly, so I have to have like high waisted, and when I know I'm going to wrestle, I make sure I'm extra tucked in, you know, like, so, you know, because people can be a little bit cruel, you know, and so they'll see, you know, you wrestle, and then online they'll be like, oh, Saraya or Paige, whatever they want to call me, like it got fat or something like that. And I'm just like, actually, I'm struggling with something right now, and I'm kind of insecure about it. And it really does help when you say that I got fat because I can't help it. And you know, it'll go away. It'll take even the same day. Sometimes it can go away, but sometimes it'll take my whole cycle for my stomach to go down, or it will blow even outside my circle, cycle. So you can get a little insecure with it, especially when you're supposed to be on TV and you're supposed to be in peak condition, you know. And then you're just like, oh bloody hell, I got my endo belly. But you know what? A lot more women in the locker room as well who didn't know they had endometriosis. When I tell them my symptoms and my stomach, they're like, oh my gosh, like I get the same thing. And it helps them too. So if you see us wearing high-waisted stuff, 9 times out of 10 it's because we have endo belly.
I'm so sorry for those unwelcome speculations that so many people make.
Yeah. One said I was pregnant before too, and I was just like, there was a picture where I was side of stage from my boyfriend's, you know, because he's a successful band, and so I'm there, and I'm really proud of him, so I'm taking pictures, and someone took a picture of me, and I had an endo belly, right? I had my high waisted sweats on, but they started saying, oh my God, she's pregnant. And I was like, oh my God. I'm like, no, it's just my condition. It happens, you know, and it just makes you, it can make a woman feel very insecure for sure, you know.
Well, you're doing an amazing thing by
Thanks.
using the platform to bring attention and awareness to this. I mean, that's one of the most important things
Thank you.
as
Thanks for having me on here with you too, because I love talking about it. And, you know, Taylor, who you've been in contact with, she's awesome. She's my right-hand woman. We were just really excited to get this done. She was yelling at me. I was like, I'm nearly home, I promise, you know. But I was so excited to do this because, again, like, I want to use, again, my platform to help because, like we've been saying, like I've repeated a few times, like a lot of women think they're crazy and a lot of people accuse them of being crazy for this disease. And it's just, I just want people to realize that it is a real thing and it's very painful for a woman, and mentally and physically it can be really rough on a woman. I have a friend that had to get the cells removed because it went all the way up into her rib cage and stuff like that, and she had to have, like, she has this huge scar going from hip to hip because it was just like it was late in the game, you know, and people weren't taking it serious, and then she had to get so much, like, all these cells removed, and it was really rough on her body. And she's so positive and she still looks absolutely fantastic. Like, you can't tell she has anything done, you know, and this just like shows you her scar. But it's just I just wish more people were just aware. So I would do this every week with you if you wanted to, like, so we can talk and, you know, and get out there and just, yeah, I just want women to be okay, dude. And I feel like we just kind of get pushed to the side a lot of the time in the medical field, which is a bummer.
Yeah, definitely. And I think that every single person needs to know about this because it affects up to 10% of women in their reproductive years.
Big number.
Yeah,
That's a big number.
it's a really
Yeah.
big number. And if you think about it, think of all the productivity lost, all the years of, of productivity and happiness where someone is unable to go to work or school.
Yes.
It affects relationships.
Yep. It
So
could be painful if for women during intercourse and all that kind of stuff. It's painful in every aspect of your life. It could be very debilitating. And, you know, sometimes, like, yeah, women cannot get out of bed. Again, I have another friend, and as soon as it, you know, her cycle comes around, she can't leave the bed. She cannot physically get out of bed. And again, you call into work and you're like, well, I can't come in because of my period, and people just laugh at you. But you don't realize just how deep it goes. Like, it's really awful. And I thank God, like, every day, like, I'm not like my friend who can't get out of bed. Like, I'm still physically able to get out there and do stuff. And we're kind of trained as women to just continue anyway, even if we are in pain. We're just like, whatever, brush it off, continue. I mean, we have to deal with childbirth. I feel like our body deals with a lot of pain, and we have high.
Rather dealing with pain, that's for sure.
Yeah. Yeah, we definitely deal with a lot as a woman. So I feel like we kind of train ourselves to, like, still go, still continue with our day, still be able to get up, cook, clean, you know, do work, do everything we possibly can.
You've been an athlete through all of this. How's that been like for you?
How was it during work, you mean?
Work, like, do you ever have to take off, like you're saying?
Yeah, I never take time off, ever. And it's rough because I, like, you know, the girls know, you know, we're just we're careful around each other. We'll take care of each other, and that's really cool. Having a locker room that's so supportive like that. So if any of us are having, like, oh man, I'm feeling like really rough, I don't know if I could do too much this match, they'll cover it, you know, they'll take care of you. And that's really cool. It's good to have women support each other in that way. But no, I feel like I still feel like I can't take time off for a period. Like, we just have had that instilled in us as women for a very long time that we can't take the time off to do that. But it can be rough. And traveling, oh my gosh, getting on a plane and cars and, like, just, you know, like, going from hotel to the building to, like, it's just the travel is just so rough. And especially when your knees are hurting and your back is hurting and you're just stuck in a plane for, like, you know, I just did, it's currently happening because I just went from, you know, California to Atlanta to California again. And, you know, I'm on my cycle and it's just rough and I cannot get comfortable. And it's just not fun. It is not fun. But again, I feel like as women, we're just very strong minded and we continue on. But I just want people to know that it's okay. It's okay to take the day off. It's okay to like not want to work. It's okay not to clean the house that day, not to get up and cook meals. You know, you don't have to do any of that. You don't have to, you know, you can take the day to just relax because your body's going to thank you in the long run, honestly.
Thank you for
Yeah.
saying that. That is so, it is okay to take time and space for
Yeah.
yourself. Absolutely.
Yeah, I wish I would say that more to myself, and I, you know, and I just want, you know, women to do it because if I see more women do it, I feel like I'd be more encouraged to be in like, okay, yeah, I see she's, you know, she's taking the day off and taking time for herself, running a nice bath, laying on the couch, you know, watching her favorite TV. I want to do that. I
Or
want
for
to do that. Sounds fun.
day off to be with them or take care of them.
Yeah, exactly, exactly. Yeah, I just want to be with my animals and my boyfriend. Honestly, I wish I could take this out. But yeah.
Well, let's see. Is there anything that you want to know about endometriosis that I can help
Yeah,
answer to the crowd too?
honestly, I would be open to any kind of natural remedies for, you know, what can help. Like, I know there's few things, but I feel like a lot of women who are in the chat right now, like, I see you all, you're all amazing. Hi, love you, ladies. And, you know, um, for me, the stuff that works is like bath and like some like herbal teas and stuff like that can really help it. Is there anything for you that you think works? I don't know if you yourself have it, but you've also just been around it so many women. I'm sure you've come across different remedies that they've suggested that works. I mean,
So I am one of the lucky ones in that I don't think I have it, but I've never had surgery, so I don't know.
yeah.
But I have grown up with it, and because my father's an endometriosis surgeon, and I work with him,
Awesome. Yeah.
fertility care, and so I have seen the impact that doing surgery on endometriosis patients can have, as well as appropriate care from as a child. I saw that. So,
Yeah.
so in terms of the more natural remedies that can help, I mean, one thing to remember is that endometriosis is a progressive disease. So as long as the tubes are open and you're having a period, it can continue to develop.
Yeah.
Things that can help, and especially if you already have GI symptoms, like you're saying, like endobelly, is an anti-inflammatory diet. So following anti-inflammatory diet, FODMAP. I don't know if you've heard of FODMAP,
No.
but
No.
there's specific diet where you avoid certain foods
Yeah.
that can that causes the bowels to have to do extra
Is it
work and causes
like high in sodium and stuff like that kind of stuff?
it's not high in sodium, but it's like no onions, no garlic, like broccoli. If you, it's very very specific, and since I don't follow it, I don't know it as well. But if you Google the FODMAP diet or anti-inflammatory diet,
Yeah.
there are a lot of suggestions there. So that's probably the best. And I've met a lot of patients where that really really helps them with daily symptoms and helping with endobelly. So that if, in terms of natural things, that's one thing I would think about.
Yeah.
And like you said, like heat baths, like whatever herbal thing. I think that CBD can help with the pain for some
I
people.
heard about that. Apparently there's like a who said it? I think it was my manager's friend or whatever. She is developing like this product, like a CBD product, which is like something that you kind of like a tampon.
Oh wow!
And yeah, and I don't know if it's like 100% that. So I don't quote me on it, but it was something very similar to that, but it's like a CBD.
Wow.
Yeah, I was just like, that's the way. Yeah, I was like, hopefully that's what she said. But from what I can remember, I was just like, oh my gosh, like, like it's just very interesting. And I'm like, oh, I mean, I would try anything. Honestly, I would try anything. I remember my boyfriend got me like this little machine, which didn't work too well, poor guy. But he was really excited about it, and he surprised me with it. And he was like, oh, I found this thing, and it like massages your stomach as well as heats up, and it just like and I was really excited to try it too. And I remember posting about it. And I had a lot of women and men comment and being like, let me know if this works. Let me know if it works. Didn't work too well. It wasn't great. It wasn't strong enough. Like, you know, but the heat works. I always say the heat works for me. And I got that from my mum because she suffered with it for a very long time. And she's had, oh my gosh, this poor woman has gone through the ringer. Like, honestly, like, she's had it really, really rough with it. She's had a lot of surgeries. Again, she had everything removed and stuff, and just she just had a really bad time with it. But the thing that would help her every month at least be relaxed somewhat, and is again baths, but also she would have a hot water bottle and she would just wrap it, with a towel around her stomach and keep it there, and she'd keep it there all day, every day, just really hot water bottle. It's crazy, just very simple.
Having endometriosis change your experience at all when you started having pain too? Was she more like, okay, I see you, or was she like, this is normal, like, get used to it?
Oh, with my mom? Oh no, she's very supportive of it. I remember when I had my first surgery, she flew from England over to America and she was with me for like 2 weeks. And she's so supportive with it. Like, I mean, again, she's a sweetheart, and she just like, she didn't have to do that, but she just knows how it feels. And I feel like she has like some kind of guilt with it, because I don't know if it's hereditary or not, but I don't think, is it?
Actually, there's no specific gene identified, but it can definitely run in families. If one of your direct family members, like a sister or mom, had it, you have a 70% increased chance of having it. If you think about it, ways that really increases the chances of having it. So
that's really interesting. That's probably why. But I feel like she kind of has like carries a little bit of guilt with it, but it's not her fault. It happens. It happens again. 10% of us, right? You said it happens to a lot of us, and you can't change it. And I always say, if you can't change it, why are you stressing? If you can change it, why are you stressing? So you might as well just get on with your day, right? So if you guys in the comments too have any suggestions, I know a lot of you, I've seen a couple of comments now where someone was like, heat works for me too, and whatever works for me. But you're more than welcome to make suggestions, and hit me up too, and we can try and figure something out as well. But yeah.
In terms of other treatments, I mean, the classic treatment is surgery.
Yeah.
But it's a disease of menstruating every month. And sometimes hormonal suppression, just trying to calm down periods, whether it's with birth control pills or other suppression methods or IUDs, is something to definitely talk about with your doctor. A lot of people don't like taking birth control pills or any hormones. So there are other options too.
Yeah.
That's why a doctor that's well versed in how to manage it day to day is really important.
Yeah. I tried, there is a natural is it suppository? Is that what it's called? Like it's like a natural pill, right? But it's not like over the counter and stuff like that. It's actually just a herb, right? And it's called kratom, Kratom, right? And I had used that. Have you heard of that before?
She says it's very good for her, but I should do and reading about it.
Yeah, it's honestly, I do it, and you can get it at any store or whatever. Usually like a vape store has it or something like that, but it's just a plant. And who did I get recommended from it? It was another girl that had endo, but she had it, and she was just like, if you don't like taking actual medications, which I don't, because I have a very addictive personality, so I try and stay away from that kind of stuff. And I've had my struggles in the past with that kind of stuff, so I try to avoid it. I wouldn't even take a Tylenol, it's like I just wouldn't do it. So I go and see, someone like yourself that can help me. I can do surgeries or whatever. But if I'm having just a rough period, I will take just one kratom, and it does help. It eases the pain a lot. It does. It doesn't take it completely away, no, but it does help me get through my day a lot easier if I'm having a really, really bad one. Like if I have to go to work, I'm like, okay, like I'll have, my herb and then call it a day.
That's good.
Yeah.
I'm definitely going to read about that more. Yeah.
Yeah. And the one thing though, if you take too much, I just want to say, if you take too much of it, it can make you nauseous. That's why it's just take as written on the back. Because the nausea, I've had it before where I was just like in so much pain. I was like, I should take an extra one. And I was like, whoa, like I just was not feeling very good. So keep it to 1 or 2. Don't go any more than that. Yeah.
So some of the comments have said acupuncture.
Acupuncture, yeah.
Chamomile tea. They use tranexaminic acid. That's a medication that can help decrease the amount of bleeding in a period. And it's non-hormonal. So ask your doctor about that. In the U.S., the brand name is Lysteta.
Okay.
So we brought up as well. And some other comments, somebody says that they had an IUD.
That's interesting. I would love to not have bleed as much because you can have really heavy periods too.
It's a little bit less of
Yeah.
the time.
Yeah.
Yeah.
This is my dog. My dog loves to be on camera, let me tell you. Look at him.
So cute.
He loves to be on camera. I've got a couple of them, but they love to. As soon as there's a camera on, I'm telling you, I'm not crazy. These dogs love to be in the spotlight. Trying to steal my my moment. All right, you guys. Yeah. I'm so happy we could do this. I'm so happy there's people in the chat. Oh, there's Taylor right there. Look, Taylor Ray, my right hand woman right there.
Taylor.
Making sure I'm on time for Steph.
Well, we don't want to take up too much more of your